Should doctors have to take random drug tests? Should they have to make sure addicted patients get too many prescriptions? Should the limit on damages for medical malpractice be raised for the first time in 39 years? Those are the three provisions of Proposition 46, the Patients Protection Act, on the November ballot. In a moment, we'll get the pros and cons. First, here's April Dembosky. She's health reporter for KQED. That's public radio in San Francisco. Hi, April. Good to have you on our program.
Hi, thanks. Good to be here.
Let's just go over each of these provisions one by one, and let us start with doctors getting random drug tests. It would be the first time in the country that that was required.
That's correct.
Elaborate on what the proposition says about it.
Well, this is actually probably, there's more text on this issue in the proposition than the other two. Basically, what the proponents say is that, so many other professionals in other safety-sensitive positions are already drug tested: pilots, astronauts, bus drivers. Hey, why not doctors? They're taking care of patients in life or death situations.
Okay. The provision that doctors have to make sure that addicted patients don't get too many prescriptions. How do they do that?
Well, California has a database of narcotic prescriptions. Almost all 50 states do. And basically what Proposition 46 says is it would make it mandatory for doctors to check that database before prescribing a prescription to a first-time patient.
How would that be enforced?
That's a good question. I don't think that's completely clear.
Okay. And finally, the provision having to do with the limit on damages for medical malpractice.
Right. So back in 1975, California passed a law that set a cap on the amount of pain and suffering damages specifically that victims could get in a medical malpractice suit. That was set at $250,000. And what the proponents say are that this is bad for patients. This is bad for victims. It means that they can't get access to the court system because lawyers will be unwilling to take their case. And so they want to see that increased at least in line with inflation, which would put the cap at $1.1 million.
And who's putting the money on each side?
Well, the no side has out-fundraised the yes side by about 10 to 1. On the yes side, the main backers are trial lawyers. There are some patient advocacy groups as well. They've raised about $6 million. And on the no side, the biggest contributors are medical malpractice insurance companies and doctors' groups. Okay.
Let's now take a look at each of these provisions with advocates for and against, and we'll go provision by provision in order to try to simplify this for our listeners. First, let's begin with an advertisement against Prop 46. Here it is.
Shh, there's a secret inside Proposition 46, a troubling provision that puts your personal medical information at risk. It's right here.
Prop 46 requires doctors to consult a vulnerable government-run database containing your personal prescription drug history, open to law enforcement, hackers, identity thieves, or simply accidents.
Once again, that's an ad against Prop 46. In favor of Prop 46 is Bob Pack. He is the man who authored this proposition. Good to have you on our program.
Yeah, thanks for having me.
What about this? There's a lot of concern that's been raised about privacy, about medical histories becoming known.
Well, it's just a very bogus argument by the medical lobby to try to shoot down Prop 46. In fact, the CMA, the California Medical Association, for the last 2 years has been a strong proponent of checking the cures database by doctors, and the current president and the past president have openly supported it with letters on their website, and in almost every meeting they go to, they have likened it to a great tool for patient safety and to reduce prescription drug abuse. Why did you put it in the proposition? Because 2 years ago I helped co-author a Senate bill in the California legislature, and that would require doctors to use it and require doctors to help fund the program. And in order for it to pass, we were forced to remove the element of having doctors required to check it in order to get the funding part through.
Okay, again, Bob Pack is author of Proposition 46, in favor of it, of course. Testifying against Proposition 46, Louise McCarthy. She is president and CEO of the Community Clinic Association of Los Angeles County. Good to have you on our program.
Hi, thanks for being here.
What's wrong with this provision?
Well, I think the biggest piece of this, Warren, is that it's mandatory. While we all share the goals of better, safer prescribing, actually at the Clinic Association of LA County, we have been working with our providers to help them get registered for the Cures database to be able to get up and running on it. This database, as it currently stands, is not ready for prime time. So Prop 46 would force all prescribers and dispensers, including those in our member clinics, to check the Cures database prior to prescribing or dispensing medication. So the database already exists, but it's underfunded, it's understaffed, and currently it's technologically incapable of handling the massive increase in demands that this ballot measure would put on it effective upon passage.
So when might you be in favor of making it mandatory?
Well, according to staff at that work on the Cures database, they anticipate that July of next year it will be up and fully functional. What we would be able to do for the future would be, let's first try to incentivize people getting on and starting to use it, getting the data in there, making sure that it's safe and effective, and then work towards the mandate of actually using it. I should also say, Warren, that across Southern California and San Diego and now in LA, there are actually safe prescribing task forces that have been getting together to work on the question of safe pain medication prescribing, to make sure that we do not allow people to shop for meds, that we are better able to treat people and their pain so that their lives are going to be more functional going forward, and that there's better coordination across the system. So we're interested in safer prescribing, absolutely.
Bob Pack, a quick response. What about waiting till next year when the database is up and ready to go, according to Louise McCarthy?
No, that's not the valid argument that they're really purporting. It's the SB 809, the bill 2 years ago that required doctors to check it, was to become effective in mid-2016, and they still fought it and killed that bill. So whether it's 2015 or 2016, they're against using it because they don't want dirty doctors who are actually abusing narcotics or diverting them for financial gain. They don't want them to be caught, and that's their real motivation to fight it. The 3 states already have mandatory checking, and all of the data that's in the database, that's been collected since 1997. There's no change in that.
Okay, we need to move on. Let's go to the provision that requires doctors to be randomly tested for the use of drugs. Here's a commercial in favor of Proposition 46.
Look at all these children. They all lost their lives because of preventable medical errors. Now the 3rd leading cause of death. Only heart disease and cancer take more lives. Proposition 46 will save lives with drug and alcohol testing to make sure impaired doctors don't treat someone you love, safeguards against prescription drug abuse, and holds the medical industry accountable for mistakes.
Louise McCarthy against Proposition 46. What's wrong with that?
Again, Warren, I think the question here is of how it was written and the way it would be enforced. The proponents have said that they've modeled this after the FAA drug testing provisions. However, it is not. It actually cherry picks certain provisions so that doctors get tested, but not nurses. So as you look at the continuum of care, when a medical error might occur, it's often a team that's touching a patient in the course of their stay, yet putting the onus on the doctor only really makes it arbitrary. And that's one of the reasons why civil rights groups have actually stepped up to join in the No Coalition, because they see this as arbitrary drug testing.
Is it a bad idea, though, to have doctors tested, given the fact that some of them have, in fact, caused terrible problems because of their own addictions?
There certainly are ways to enforce testing in a way that are more reasonable. Having a 12-hour window from the time of reporting the incident, for example, is probably not the way to do it. If if you're looking at, you've got 12 hours to report and get drug tested, otherwise your license is suspended, and it's all contingent upon when the incident is reported, that doctor may not even be in the country. They might be in surgery for multiple hours. It's really unworkable the way that it's written. And I think that's the challenge, especially here, Warren, is that you've got 3 propositions in one, all of which would have to stand as written if they were passed. And so there's no opportunity to repeal or retool this. There's no opportunity to actually shape this.
Okay, Bob Pack, back to you, the author of Proposition 46. Why not include the nurses when teams, in fact, work on patients?
Well, maybe that will happen. I mean, we formulated this around the most dire need for patient safety, which is the doctors. They're the ones that are operating. They're the ones that are prescribing morphine and narcotics. So we need to start with them. And, the Medical Board of California cites, there's 8 to 15,000 doctors in California abusing drugs and alcohol, and yet they have no authority to do anything about it. So we feel it's vital that they are held to the standard that, like pilots or police or bus drivers, when you might hold someone's life in your hand, you should be able to say that you are absolutely clean. And I just can't think of any reason why a doctor wouldn't want to police their own profession.
Civil rights groups, according to Louise McCarthy, are opposed because it doesn't include everybody. What do you say to that?
Someday it should include everybody, but we have to start somewhere. And I'm sure if we put everybody in there right at the get-go, they would complain equally as well that it's too wide and too broad. So we're starting with doctors, and we think that's the most vital, critical element for patient safety.
All right, let's go then to the provision having to do with the malpractice cap, so-called, which was set at $250,000 in 1975 when the law was first enacted. Bob Pack, why should that be raised?
Well, it should be raised because 10 years ago I lost my 2 children who were run over and killed by a doctor shopper of narcotics. And I wasn't able, and it turned out that there was multiple doctors all working at the same hospital who fraudulently prescribed these narcotics. They didn't verify an injury on the person. They didn't check the medical file. They didn't talk to each other, and they all prescribed hundreds and hundreds of narcotics. And it cost my children's lives. I wasn't able to sue those doctors because no attorney would take my case. And because of a low cap of $250,000 set almost 40 years ago, it's just economically not viable, and therefore victims like me, you get no compensation for the death of your child, and you can't even get to court and get accountability, so there's no incentive for doctors at the hospital to change or improve their protocols. They just go back to their regular old ways of practicing.
Why wouldn't they do that? Because they care about their patients. I mean, aren't they supposed to be in the helping profession?
Well, yeah, in a rosy-colored glasses world, yes, but that's not reality.
Let me go back to Louise McCarthy, once again opposed to Prop 46 with the Community Clinic Association of Los Angeles County. What's wrong with that idea, given the fact, as Mr. Pack described, you can't get a lawyer to take your case?
You know, Warren, this characterization of dirty docs and folks that are not willing to actually improve the care that their patients get, that is just such an affront to the folks in the community clinics who are working to provide quality, comprehensive care to the most underserved in L.A. County. Across L.A., we have 85 organizations serving 1.3 million patients a year, the majority of whom live under the poverty level. Up until the implementation of Obamacare, the majority of whom were also uninsured. We have been stepping up to try to improve services, to improve access, to improve quality, and being cast as dirty docs that are unwilling to really care for our patient population is you know, it's hurtful to us, I have to say, because these are community providers who are struggling to hire clinicians, to their nonprofit organizations that are living on the margin with between a 1% to 2% margin on their finances, with less than a month's cash on hand to keep their operations running, covering the cost of malpractice insurance in order to be able to provide care to their patients.
Okay.
We're working to improve care.
All right. Again, Louise McCarthy is opposed to Prop 46. She's the president and CEO of the Community Clinic Association of LA County. Bob Pack is in favor of it. He wrote it. He is the author of Prop 46. April Dembosky, quickly back to you with KQED Public Radio. A little bit more about the campaign now. Once again, who's spending how much?
The no side is spending about close to $60 million. That's the medical malpractice insurers and doctors, and the yes side has put in about $6 million.
And there's been a lot of controversy about the ads, particularly with regard to that privacy issue.
There's been a lot of controversy about all the ads. There have been a lot of complaints that they are deceptive, and I think, I've analyzed the ads as well, and I do think that they're pretty misleading, frankly, and especially around the spending and the cost of Prop 46. The concern is mainly that with the medical malpractice cap going up, that will cause more people to file lawsuits, and that will increase the cost both for doctors and for counties like LA that run their own hospital systems and pay their own litigation costs. Now, if you look at the academic studies, there does seem to be evidence that raising the cap will raise medical malpractice insurance costs. The question is how much, and the studies have found a range between 5% and 25%.
What do the polls show?
The polls show actually that support for Prop 46 has been going down. There was 58% support over the summer, and that's now gone down to about 34%. It is important to note, though, that the undecideds have gone up. About 30% of voters haven't yet decided which way they're going to go.
Okay. Election is getting closer and closer. April Dembosky, thanks very much for being on our program.
Thank you.
Health reporter for KQED Public Radio.